Hi everyone, this is Health Highlights, show about health, health professionals and the people and the stories behind the names that we hear about that we seldom get to meet. And many of you have probably heard the name Marc Russo. And here we are today at the Hunter Pain Clinic, which Marc is the director of, and he's also the director of, and I'll get this right for you, the Hamilton Day Surgery, the Genesis Research Service, and he's co-director of Innovate Pain Management Program here in Newcastle. So it's great to have you on the show, Dr. Russo.
Great to be here. Thanks.
So can you tell us firstly, Dr. Russo, what is the vision for your business?
It is to be a multidisciplinary centre for managing pain.
Yep.
Pain is sufficiently complex that it's no one individual who's going to have all the skills that a patient is going to need to call upon to assist them in their journey as they manage their pain. So at Hunter Pain Clinic we aim to have the sufficient number of people to be able to deliver the services needed.
Wonderful, and I mean you've been around for how many years now as a service?
About 18.
Yeah, so it's certainly a very well-known name in our region, so we really appreciate your time today. So how did you get into pain medicine?
Well, it was a journey. It started off with me being a general practitioner.
Yep.
And then going into the specialty of anaesthesia, and then realising at the end of it that whilst I loved giving anaesthetics, I missed talking to people.
Right. Yes.
Might be obvious.
Yes.
But and I really wanted to combine the skill set of anaesthesia with the love of talking to people.
Wonderful.
And that sort of coalesced into the world of pain medicine.
Beautiful, beautiful. So then that leads us to, at the end of last year, you guys released a paper or a study around the effects of slow breathing. Can you sort of tell us a little bit about that paper and why did you release a paper on slow breathing?
Yes, essentially we've been looking at the breathing patterns of patients who come to us at the clinic and noticed quite a lot of dysfunctional breathing and then enlisted the work of a breathing therapist, Dino Rourke, to facilitate improved breathing techniques. When we looked at the literature, what we saw is that there was different studies in all different places, but no one had done the basic science.
Yes.
To say what is slow breathing, and if you practice it, what happens to your body. So this was an effort to gather in all the work that had ever been done in this field and actually put together the science so we can say this is what happens to you if you practice slow breathing.
Wow. And so did you get any findings out of all the research and from what you've done? Like, was there any result from that paper?
Yes, what it showed is that rather than simply being considered a automatic event, we all breathe every moment of every day, whether we're awake or whether we're asleep. But rather than being an automatic event that has no other effect other than pushing air in and out of the lungs, it is actually central to how your heart functions, how the blood vessels function in your body, how your adrenal gland functions, the activation of major nerves such as the vagal nerve, all of which coalesce together. And to optimize all those things, if you want to have an optimal outcome for that, then actually breathing at a particular rate, 6 breaths per minute, will actually induce all of these to move into their optimum zone.
So 6 breaths a minute, that seems quite low in comparison to what most of us would think about breathing. Is that what your research is showing?
Yes, so normally defined breathing is somewhere between 8 to 20 breaths per minute. And above that we call it tachypnea, and below that bradypnea. Now in fact, if you practice it, you can breathe at 2 breaths per minute, or you can, if you're a yoga practitioner, you can breathe at 1 breath per minute, and do so for a sustained period of time. So what seems slow, probably in fact is in fact optimal.
Wow, there you go. And so what were you hoping to get out of this research paper, and what did you really want the health industry to see from the paper that you produced?
There's probably 2 things.
Yep.
One is from the point of view of clinicians, and one is from the point of view of people, of patients.
Awesome.
So from the clinician point of view, I want them to start to think about that breathing is not just breathing. Yes, if you have emphysema or you have asthma, yes, you go to a respiratory medicine doctor and they will look after the pathology associated with your condition.
Absolutely.
But what should be also thought of is, just as we think about optimizing heart function for an athlete, how do we function breathing function for a normal person, or even for an athlete? and that just within the normal range of breathing, there may be optimal breathing.
Yes.
So that was for clinicians. Now for patients, what I'd like people to do is to become breath aware.
Yes.
To actually think about their breathing, think about their posture, think about how they breathe, whether they activate their diaphragm or not, and then look at actually spending a little bit of time working and training to see if they can optimize their breathing function, and then see what that actually delivers to them in their everyday life.
Wonderful. And are you finding, obviously, how did this sort of come about in your clinic that you've been looking into this whole area of breathing?
I was seeing common patterns. When you see thousands of patients a year, you start to get what's called pattern recognition. And that's the hallmark of a physician that uses it for diagnosis.
Yep.
But I was seeing common patterns that there were people who were somewhat overweight. They often had high cholesterol. They often had high blood pressure. They often had esophageal reflux. And they often, when I looked at them, had abnormal breathing.
Mm.
And I kept seeing this pattern over and over again. And I started to wonder whether at the heart of it was related to breathing and their weight driving other conditions down the line. And so we wanted to, in the clinic, start to tackle that, both from dietitian and weight reduction, but in particular taking those people with very abnormal breathing but hadn't been diagnosed as emphysema or asthma, and they don't actually have a pulmonary disease. But if you have somebody who gets breathless talking to you, then that probably suggests they're not optimally breathing at all. They're doing the opposite of optimal breathing.
Absolutely. And so, can you give us in simple terms, because you talk about, it's called autonomic optimized respiration or functional breathing. So what is your definition of what that is?
So that was taken from our paper as a concept, to indicate that if you want to maximally suppress your sympathetic nervous system, that's the fight or flight response, that's responsible for elevating blood pressure. If you want to induce a level of calmness within yourself, if you want to make sure you're not a chronic overbreather and you're lowering your carbon dioxide level, which then makes you very anxious, then you actually want to work at breathing around that 6 breaths per minute, 4 to 8 breaths per minute. And that level of breathing inherently means that you have to work your diaphragm.
Yes.
If you just breathe through your chest, you won't achieve the expansion required to lower the breathing rate. As breathing rate goes down, so must lung volume go up, so that the two together multiplied remain the same. So the way to do that is expansion of the diaphragm. And I think so many of us hunch over and we don't think about our posture, we don't think about activation of the diaphragm, but with training you become aware of it, and then with additional training it occurs subconsciously.
And it's one of those things really, it's training really, because you can't necessarily change your breathing yourself, can you? You sort of need someone to at least sort of help you down that path. Would you agree?
I think if you want to do some simple things, you could sit in front of a mirror, look at how you're breathing, and then slow down your breathing. And there are apps that you can get, such as Breath Pacer and so forth, that you can download off the iPhone at no cost. But if you certainly have symptoms, if you have easy breathlessness or easy fatigue or tiredness and these other features, you may wish to actually see a breathing therapist for a formal documented analysis.
Absolutely. And so what are you finding are the benefits of this slower breathing technique in your clients, like in terms of the health benefits they're seeing, apart from, yes, they're feeling better in their breath, but what other health symptoms are they noticing actually are getting better?
So we've, apart from one-on-one with patients, we specifically put a breathing component into our Innovate Pain Management Program. This is a group-based program for patients who have persistent pain that cannot be relieved, and they are going to have ongoing pain, and the program is designed to optimise their ability to cope with and manage their pain and give them back as much function in their life as possible.
Awesome.
So by incorporating a breathing component into that, what we've seen is that the patients are able to use that after the program, so that if they have a spike in their pain, rather than then start to breathe fast and breathe shallow and then lower their carbon dioxide level and start to feel terrible and anxious, which compounds the fact that their pain has gone up, they're able to use this to curtail that event, keep their breathing under control, and the pain spike seems to pass quicker.
Wow. And so what conditions, apart from the pain that you see, would you say that someone who potentially might have a breathing problem needs to maybe look at getting some breathing training to actually help some of their conditions? What conditions?
I think there's a lot more work that needs to go into this to actually define that group. But the common thing should be that, if you don't have major heart disease or major heart failure, you don't have emphysema, you should be able to walk at a brisk pace on the flat without getting short of breath. A slow pace uphill without getting short of breath. If those things are difficult for you, then yes, you may be a bit unfit, but even so, it may be the breathing that is actually contributing to those factors. So then that's something that can be looked at.
Absolutely. And so, last comment about breathing and about keeping your health and well-being going. What would you say to everyone out there who, a lot of people are suffering from chronic pain and things like that? What would your advice be to them around their health and looking after themselves?
I would say you go to the doctor and you get your blood pressure checked. You get your cholesterol checked. You go to the supermarket. You try and minimise, your saturated fat intake. You think about making sure that everything is working well. Breathing is one of the simplest things that you can optimise. We have in the literature search that we did, we covered everything ever published on the subject. We couldn't find a single downside to actually optimising your diaphragmatic activity, slowing your respiratory rate. There appeared to be no downside to this.
Yes.
So it seems a very simple thing to engage in as a health promotion activity.
Absolutely. Well, look, that's wonderful advice, and thank you so much for your time, Dr. Russo. Really appreciate it. And look, thank you everyone for joining us. I'm sure you found that absolutely fascinating as I did. And so now you can go into the mirror, take a deep breath, and learn to slowly breathe. So if you want to find any more information about Dr. Russo or slow breathing, we've got some information right now on the screen, so you can follow up. I'm sure Dr. Russo will be more than happy to answer a few questions that maybe you want to throw through on the comments. Thank you for that. We appreciate that. Thank you for joining us. We'll see you same time, 12:30 next week. Remember, healing is a gift, health a responsibility. Have a great week.